everybody. Karen Roby and Veronica Combs here for Tech Republic. And most conversations, of course, Veronica, these days centered around coronavirus and the
Yes.
implications for all of us and for tech and business and in general. But I think this article that you put together is really a great tool to help people talking about different ways that tech pros are coming together to offer services and different things that we need and healthcare professionals need as well. So I think a good place to start is just off the top, some of those that you found were out there available.
Yeah. So, there's so much bad news and so much worry and uncertainty. It was nice to look at things that people are actually doing to help. So, on a real basic level, some digital health companies are taking their telemedicine platform and offering it for free. So if a doctor maybe hadn't been using this kind of interaction with patients before, it's a way to basically talk to someone like we're doing now about healthcare issues. Instead of going to the ER, going to the doctor's office, you can maybe talk to a nurse's assistant or talk to an RN and get, say, I have a fever, I have a cough, what should I do? It's sort of a first screening that doctors and nurses can use to help people decide what to do next without having to leave their home. Because one of the big, as I'm sure you know, one of the big risks is that if everybody goes to the doctors will be overwhelmed and maybe the healthcare providers will get sick. So they're really trying to use telemedicine and these free platforms to try to avoid that.
Yeah, telemedicine never been more important for all of us. And I know one of them too. I thought this caught my eye. You talk about chatbots, how
Mm-hmm.
in terms of screening for symptoms and things like that. Expand on that a little bit.
So last week, President Trump announced at a press conference that Google was building this site that was going to help people understand their symptoms and maybe direct them to testing sites. Well, a chain of hospitals out in the West has already done this. They worked with Microsoft technology to basically help people answer a series of questions. And in the healthcare world, they call this triage. So have you traveled out of the country? Have you been exposed to anybody that you know has symptoms? So again, it's a way to sort of get answers, because if you've tried to call any providers or call the CDC or call your health department, you're probably waiting online, waiting on hold, waiting. But with the chat bot, you can answer these questions and at least get a little more information and be a little more reassured. Well, I don't have these symptoms, so I'm probably okay. I don't have a fever, so I'm probably okay. So again, it's a way for healthcare providers to sort of deal with this load or this volume of questions coming in from people in a way that's very rational, very scientific. It's not memes on Facebook. It's information from the Centers for Disease Control and Prevention. And it's a way to deal with volume and to get information out to people so they know what to do. So it's a chain of 51 hospitals and about 800 medical clinics. It's in 6 Western states: Providence, St. Joseph's Health. They worked with Microsoft. They have this chatbot, and anybody can use it. Honestly, you don't have to be one of their patients. You can just go and check it out.
Excellent. And one of the things, obviously, for when we talk about kids and the center of this, and parents and juggling and having to do school at home possibly, or not having childcare anymore, all of those kind of things. There's so many factors to consider here. But one of the things you noted on there in terms of a calculator to help with childcare expenses, is that right?
Well, it's actually a scheduler. So if you say, I have to work on Monday and Tuesday, and you have to work on Wednesday and Thursday, we could enter our availability in or our work schedule in, and then the scheduler says, okay, Karen can help out from 2 to 4 on Monday, and Veronica can help out on 3 to 5 on Friday. So even if the idea is that several families could get together and sort of share their capacity to take care of each other's children. Because if you're a first responder, if you're a food service person and you have to be at the hospital or you have to be at a clinic, you can't leave your 2-year-old home alone. So the idea is that instead of doing your own spreadsheet, like, well, I have these days and you have these days, it's a way you just enter in the data and it spits back a schedule. So okay, Monday it's this person's turn and Tuesday it's this person's turn. So it's very low tech, but it is a way to help, again, make sure healthcare workers have support at home so that their children are taken care of while they're taking care of all the rest of us.
Yeah, we definitely need them. Certainly the term "it takes a village" has never been.
So true. I mean, knowing that your kid is in a safe place, you can do your job. But if you're always worried about that, then, you can't help someone deal with their fever or whatever the problem is.
Right, right. All right, and finally, one of the last ones I wanted to touch on, Veronica, I think is really important, and we're still just scratching the surface with this in terms of being homebound, and and still in the early phases of this, but being isolated certainly will have some repercussions for people that aren't used to it, or aren't dealing well with it. So, what did you find in that realm?
So there is another collaboration between Glimpse and XR Health and then Foretell Reality. And they have clinics, virtual clinics. It's a virtual reality experience. They have clinics in 17 states, and they help people with really serious health problems like multiple sclerosis and things like that. And basically, it's a virtual group therapy session. So they actually will rent you a headset. So you have your big headset and it's groups of 8 people. You meet with the doctor first, and then you go into this virtual reality room, and it looks like a living room, and there's chairs, and there's a big picture window. And basically I think they're 90-minute sessions, and you just talk with other people. And so maybe it's about your specific healthcare condition, but in this instance, on April 1st, they're going to be offering counseling sessions for people to deal with the impact of this social isolation. Because obviously you don't want to get sick with the coronavirus, but being isolated from people, it takes a toll as well. It leads to depression. It can make heart disease worse. It doesn't seem as risky as a virus floating around in the community, but it can have a big toll. So I thought it was a really creative way to help people cope with this isolation. And this is one company in 17 states, but certainly it's something that with a little bit of logistical support, other counselors could do as well.
Yeah, most definitely. We're going to need that certainly as we move through this and find our new normal, Veronica. All right. Well, thank you so much for chatting with me about this today. And of course, the full list that you put together with even more information can be found there for everybody on Tech Republic.
Yes. Thanks, Karen.
Thank you.